So with that, I'm going to jump into our second one, which is how can our rural communities work to disrupt the stigma historically surrounding mental health? And if you have any resources that you think would be helpful in this, please feel free to share.
Should I go first again? Okay. So I think honestly, like the biggest thing that people can do is being open about your own mental health and starting the conversation. Being there for somebody who needs help, reach out and tell someone you're struggling. That is like such a huge first step. And I think just by doing that, you'll realize you almost have like this sense of relief. I don't even know how to explain it, but I know the first time kind of I shared my story publicly, I was at a chamber networking group and I was actually talking about our 5K event. And something inside of me just said, you know what, I'm going to share with everybody in this room that I struggle with depression. I don't know why I decided to do it. And this is 11 years ago. So I feel like 11 years ago was like, seems like forever ago. And I had probably 3 or 4 people come up to me afterwards. One of them, who is now my board chair, who lost her brother to suicide. But I had like 3 or 4 people come up to me afterwards and say, wow, like that was so brave that you said that. And I struggle too. And so just opening up that communication with people and being vulnerable, which I know is not easy for everybody to do, and especially for guys. And posting about your struggles on social media, which maybe feels really uncomfortable, but you just never know who you're going to touch and who will relate to your story, and making it okay to talk about. One of the first things we did too as an organization was we hosted a community outreach event. And so we had at a church, a local church, we had a speaker come in and talk about mental health and suicide prevention. We invited mental health counselors and therapists to come to that just as resources. So I just really feel really strongly that when you share your own struggles, you'll be amazed how many other people will come forward and relate to that. Another thing that I always do as kind of to support other people who are going through something is just helping remove those barriers. I know Monica kind of touched on that too, is, you know, even when I'm in a dark place, and my husband is kind of my safe person, my go-to person, I have that plan in place. And one really simple step he can do for me is making an appointment with my therapist or getting me back into my doctor to recheck meds. Sometimes just that barrier of picking up the phone and making that phone call can be extremely hard for somebody who's not in a good place mentally. So if you know somebody who's struggling and they've reached out to you, you know, maybe offer that up and say, hey, look, I'd love to, you know, can I call your doctor for you? Is that okay with you? So that's one other thing I would recommend. And I would also, educating yourself is a huge, huge deal. I just think there's so much for everybody to learn about mental health, what to do in a crisis situation. And one place to start would be taking a mental health first aid class. You can go to mentalhealthfirstaid.org, and you just type in your city and your state, and you can find local locations where you can get certified. It's an 8-hour class and it's 100% free. And I promise you will leave there learning so much, especially when you're in maybe a crisis situation for either yourself or for, you know, a friend or a family member. It'll just give you kind of a guidance on what to do and what not to say and things like that. So.
Yeah, thank you, Katie. Monica, what do you have to say?
Oh gosh, I'm going to echo a lot of what Katie said. I was looking down my points I had written down and I was like, she's got it. It is so similar. So that must mean we're on the right track, right, Katie? Making mental health part of the conversation. It's normalizing it. So just like how we will talk about having migraine headaches, or how childbirth was for those of us who've given birth to kids, or if whatever physical health thing that we are so comfortable talking about, mental health needs to be just as comfortable to talk about. And that's what's going to go a long way to normalize mental health and mental health treatment, and to normalize or to take away the stigma surrounding it. A powerful way to do that, Katie said, and I will echo, is sharing stories. It's being vulnerable. It's finding initiatives and avenues that those stories can be told, even if it starts out with your own story on social media. It's powerful for people to do that. Looking at like the farming community that I work with, Red River Farm Network and the Minnesota Department of Ag joined together to produce a series of podcasts that are all about farm stress, but it's farmers telling their stories. So female farmers, male farmers, farm youth. It's around people who have lost someone to suicide, who are suicidal themselves, just a variety of different struggles. And that is called Transformation. And it's on the Red River Farm Network website. And Teresa, I did not include that with my resources, but they're 15 to 20 minute podcast episodes that are really powerful because it's people telling their own stories. So I would recommend that is just something to put out there and to share, especially if you're in a farming community. Another resource I would share is there's a website called RHI Hub, and it's all around rural health. So all aspects of rural health, but they actually have a rural mental health toolkit that you can download. And there are aspects of that you can pull out and things that you can work on implementing in your community. Just talking a little bit about initiatives in communities when you're trying, and I don't know, Katie, if you found this too, but sometimes people are a little leery about jumping in when it's about mental health. And so the more connections you can make with all sectors, private, nonprofits, your government agencies, faith communities, bring them all on board to sponsor initiatives or to provide a meeting place or food for the meeting or whatever, because the more partners you have from all sectors, the more powerful your impact will be on the community. And then my only other point was working to have mental health services embedded in rural clinics. We have come leaps and bounds with this, but it's still, we still have a ways to go. Most of our bigger healthcare systems do have behavioral health components embedded in their rural clinics on some level, but not all. And sometimes it's pretty slim pickings, like, okay, Tuesday afternoon from 3 to 5, we have a therapist. And outside of that, we don't. And you have to travel to wherever, or the wait time is really incredible. Telehealth has helped with that, but we all know that telehealth isn't for everyone. So those would be my, I guess my recommendations or thoughts just around really disrupting the stigma in our rural communities.